everybody. Today we will talk about the stages in cancer and what is our emphasis on each stage when we go on treating these patients. So, whenever a patient comes to us, we have to see three things at the back of our mind. One is what is the name of the cancer, which is done by the biopsy. Second is what is the spread of the cancer, which is done by the scans. It can be a CT scan, it can be an MRI, it can be a PET CT, or whichever way it might be, or it can be a combination of a PET, MRI, and vice versa. Once we know the name of the disease and we know the spread of the disease, we come to know about the stage of the disease. And the stage of the disease is the most important thing which helps in making our clinical decisions in medical oncology. There are basically four stages: stage 1, 2, 3, and 4. And stage 1 and 2 are known as the early stages. Stage 3 is loco-regionally advanced stage, and stage 4 is the final stage or the metastatic stage. There are different connotations about each of these stages. If it is stage 1 and stage 2, then they come under the purview of complete cure in almost 80 to 90% times, because these diseases are most likely localized at the site of origin of cancer, whichever organ it might be. If it is stage 3 disease, for example, in case of breast cancer, stage 3 disease will be local and regional in the armpit. So if you have a disease like that, then in this you might give certain treatments like chemotherapy prior, shrink the tumor and do the surgery, or you might give whole of chemo and whole of radiation and then do surgery, or you can extrapolate any one of these armamentariums according to the situation. When it comes to stage 4, this is the final stage in which the disease has already gone out from the parent tissue, that is the organ of origin. Again, for instance, if it is a carcinoma of the breast, if it has gone out of the breast into the bones or to the liver or to the brain or to any other part of the body like lungs, then it becomes a diffuse disease which is spread out throughout the body. So in this stage, the treatment remains chemotherapy. If you go by the percentages across the stages, in stage 1, again for example, in a case of carcinoma breast, the 5-year survival rates approach 90%, 95%. In stage 2, it goes down to about 70%. Stage 3, it is about 50-60%, and stage 4, it is an abysmal 5 to 7%. So everything as far as the outcome is concerned is decided by the stage of the disease. That is why the stage is the most important as far as treatment in cancer is concerned.